The global infection total since the start of the coronavirus outbreak has, by some counts, passed the 100,000 mark. While there are positive signs in the slowing rate of infections in China and South Korea, elsewhere it's speeding up. Iran recorded a dramatic rise of 1,000 new cases in the 24 hours since Thursday, with the authorities said to be preparing travel restrictions between cities to add to widespread school closures and bans on public gatherings. The World Health Organization said rapidly rising numbers are a sign of a more efficient government response.
Any country in the face of an epidemic, when it looks for cases, will find them. And if we call that a bad thing, it is. It's a sad thing for the people who have the disease. But it's much better that we understand the extent of the problem. So we commend the move towards more aggressive, targeted surveillance, and we hope that that will lead to the kind of control measures that can help push this virus back.
Among the more than 3,300 lives lost around the world so far, most have been among the elderly, whose less efficient immune systems make it hard to fight off the virus. In France, where new infections jumped by 200 on Friday, President Emmanuel Macron visited a retirement facility.
I'm asking all fellow citizens to act responsibly, to make this sacrifice. I know it is sometimes heartbreaking, but we must avoid visiting our elders as much as possible.
The European Union, with its open borders, is proving a haven for the spread of coronavirus. Italy remains the worst affected country, but Germany is catching up. Across Europe, tiny Vatican City has reported its first case, as has Serbia. And in Britain, Prime Minister Boris Johnson has announced a $50 million investment into vaccine research and faster testing methods. Early signs of the virus continue to spring up in Africa and the Middle East. Cameroon and Senegal join Nigeria and South Africa in registering their first cases this week. That, as the head of the UN's World Food Programme, sounded a stark warning.
If the coronavirus continues to create panic around the world and there's an economic downturn, I've been telling the European leaders and leaders around the world, you don't have enough money set aside to address the needs in Africa, East Africa, West Africa, and the Middle East right now. And if there's an economic downturn, on top of the economic downturn that exists now in Syria and Lebanon, it absolutely could be a catastrophe. I mean, absolute devastation.
And there was more bad news for the airline industry, already operating on tight margins, with losses across the industry from travel restrictions and cancelled bookings estimated to top $100 billion. The German carrier Lufthansa announced plans to scale back up to 50% of its services worldwide. Others may soon follow suit.
Jonah joins me live now, and Italy is the hardest hit country here in Europe, isn't it, Jonah? Tell us more about how the country and the people have been coping with this.
Yeah, very much still the hotspot in Europe, Italy. That death toll has jumped to 197, nearly 50 in 24 hours. That's an enormous jump, a total figure of 4,636, and all of that in just over 2 weeks since the first cases were detected. Now, the government acted very aggressively, pretty much from the start, quarantining whole communities in the north of the country to try and slow the spread. It didn't work. It went countrywide. This week, a raft of emergency decrees were passed by the cabinet. Pretty extraordinary measures in the European context, but most of these things have been tried to a greater or lesser extent in Asia, in China, in South Korea, where, incidentally, infection rates are slowing now. So you've got schools closed, universities closed, you've got places of public gathering shut down. That means cinemas and museums. You've got sports fixtures being played to empty stadiums. Even famously this week, Italians being asked not to kiss each other in greeting, if you can imagine that. But still, the spread continues. The death toll continues to rise, in part perhaps because of a large number of elderly, a very ageing population in Italy. They're particularly vulnerable, of course. But I suspect as much as anything, this is a sign for other Europeans watching, a foretaste, if you like, of things to come.
Exactly, because Germany, France are all catching up in terms of the number of infections. But within Italy itself, as you say, it's caused this incredible paralysis of everyday life, with towns being quarantined and tourism, I suppose, grinding to a halt. Do they have the resources to deal with this? Is there an expectation that it will get much worse, but then possibly the situation will get better?
I mean, in terms of resources, if you're talking about money, they've asked the EU, the Italian government, to lift their budget ceiling, and they'll basically throw as much money as they can at the problem. There are widespread shortages of basic equipment all over Europe now and the world, masks, goggles, gloves, that sort of thing. In terms of the epidemiology, the way that this disease works, the World Health Organization thinks that it sort of works in a peak and a trough, and that seems to be what's happened in China. It hits a big peak for several weeks, 6-8 weeks perhaps, and then sort of runs out of steam. That's probably what we're looking at in Europe in the coming weeks. These countries, big countries, Britain, Germany, France, Spain, almost nowhere will be spared, will hit a peak at some point. Either the warmer weather of the summer will slow the spread of the disease, they simply don't know whether that will happen or not, or it will dissipate naturally in its own time.
And what about advice? What are we hearing from health ministries, from governments? How, you know, what measures should people be taking to protect themselves?
Well, again, this is being done on a country-by-country basis. At the moment, the EU, 27 members, is trying to come up with a coordinated response. That hasn't happened yet. But on a country-by-country basis, different countries are experiencing different levels of infection rate, different levels of the disease, and are doing different things and at different times and in a different pace. But initially, it starts with personal hygiene. Of course, the big advice is to wash your hands and wash your hands often. Once it gets beyond that sort of containment stage where a few cases can be contact traced, but more and more cases can't any longer, and it moves to community transmission, well, that's the time when you've got to start distancing the public from one another. That's the time when big events start being cancelled, possibly school closures, university closures, town closures, city closures in a worst-case scenario, as we've seen in China.
Thank you very much, Jonah, staying across that story for us. Thank you.